Hi, I'm Dr. David Stoop, one of the co-hosts of New Life Live, and I want to talk with you about some help for depression. One of the interesting insights that are developing in the research relating to depression is that the reason your SSRI took 3 to 6 weeks to become effective, or even more sometimes, is that you're treating the symptoms of depression, not the direct cause. The feeling is that it's not the loss of serotonin or the loss of dopamine that leads to one to be depressed. That's more a consequence of the depression. And what they're saying is that the primary cause of depression often is high stress, and stress that's unchecked and unmitigated in terms of how we live. We live in a very stress-filled world. One of the writers talks about the stress that we live in. It's like a runner who is in a sprint. When the field judge says on your mark, he gets into the blocks and gets ready to burst out of the starting gate, you might say. And then the field judge says get set, and now every muscle tenses, and it's a high stress time. And if the field judge gets distracted and forgets to say go or fire the starting gun, and the runner stays in that position of high stress, within a moment or two, they will collapse. And that's why you'll see sometimes if you're watching a race, a sprint, is that somebody will break out of the box and everybody else breaks out of the blocks, and they de-stress themselves, because if they don't, they won't be able to perform the way they want to perform once they are set to go again. So what the writer says is that we live in a get-set world. It's like we're always getting set to go, but nobody ever says go and releases the stress. And that eventually builds up to where it leads to depression, because it creates the side effects of the loss of serotonin, the loss of dopamine, and those kinds of transmitter substances that keep us healthy and well. So what do we do about our stress? Well, the other thing that they're finding in the research is that if you were to take a brisk walk 4 times a week for 25 to 30 minutes, you would do better than taking the medication, probably, because it would deal with the cause of the depression, which is the stress. Now, a brisk walk is a walk where if you were walking with someone, you're walking fast enough that it's challenging you physically, but you're not walking so fast that you couldn't talk with somebody walking alongside you. So that's a good way to measure how briskly you should be walking. But one of the things I would suggest is take the meds, because they still are in many cases proven to be successful. But then add to your treatment protocol the idea of walking briskly for 25 to 30 minutes 4 times a week, and seeing if that doesn't change the way you experience and get rid of the depression that you're fighting and wanting to be rid of. If you need more help on that, call us at 1-800-NEW-LIFE, and make sure to talk with someone there who can expand more on what I've just been saying.